Hi all. I am Julie Weissbuch, Allina, and I am the Wellbeing Program Manager at Creighton University. So I get the great privilege of supporting the well-being of our residents and fellows. Before I jump too far in, I want to just explain a little bit about the Arizona Health Education Alliance, which is comprised of Creighton University as well as St. Joseph's Hospital and Medical Center and Valley Wise Health Hospital. And the reason that's really important is because while Creighton is our sponsoring institution, the two hospitals are places where our trainees train. So it is a complex organization and a complex structure. And so I just want to kind of lay that out as a background as I go through this. So what am I doing? Why was this important? Why did I really need to think about a framework for the work that I was going to be doing? So I started in GME 2 years ago. I've been in well-being for a really long time, but not medical well-being and not healthcare at all. And so this was really new and foreign to me. And so I was really thinking about, what do I know? I know that individual well-being is imperative, and I know institutional well-being is imperative. I knew those things. I also knew that from my previous work that environmental strategies help accomplish both of these things. So I began starting to look at what frameworks are out there, what works in that environmental space. And so our approach, I really looked at a whole bunch of different environmental strategies, and I landed on the American College Health Association Healthy Campus Framework. It worked for the environment that I was in because it was a complex organization like so many larger institutions, higher education institutions are. And what I'm going to share with you today is a little bit about what this framework is and how we implemented it. And so it is split up into 4 different categories. The first is this level of infrastructure. And this is really, what is the foundational support? Do we already have, or how do we implement basic healthcare for our stakeholders? And for us, that was our residents and fellows. And my answer was yes. They're employees, they get benefits. So yes, we do provide that on some level. So then you start to look at Cornerstone. It's not really about, at this point, you're looking at what you have and whether it's effective and aligns with the stakeholders that you have. So yes, we have benefits, but does it work for our constituents? Does it work for our stakeholders? And so you start to question that, and you start to look at that. And then you move into this idea of community. And so you start to pull in that leadership team to set well-being goals. So you're starting to look at data. What data do you have? What's available to you? Where are your gaps? All of those things. And then you start to set the well-being goals. And some of those goals might be that you need more information, and that's okay. And then the idea is when you move into culture. And so this is when those well-being practices that you develop at the community level start to become part of the fabric of the institution, right? And so it becomes at the place where it's not reliant on me or any one person. It is just how we do the work, right? So I could be abducted by aliens tomorrow, and this work would function beyond me. And that's the goal, right? And it also is at the place where, as people are making decisions, whether they're at the program level, at the individual level, at the institutional level, they start to use that well-being as the backdrop for decisions that they're making. Is this policy in line with well-being? Is this program in line with well-being, right? And so that's the framework that I then said, okay, let's use this and let's figure out how we're going to implement it. And so we created what's called our executive committee, our Wellbeing Executive Committee. And this is why it was really important for me to share with you who was comprised in our alliance, because we needed those folks to sit around the table. We needed people from Creighton as well as our 2 training sites to sit around the table. So we pulled those folks together. We also pulled other folks that we knew were really invested in well-being of our trainees. We pulled in trainees themselves, which is important, and then the folks that support our programs, right? And then myself. And so those were our folks. And so what do? We analyzed the data that was available to us. We started to look and see, okay, this is what we know, this is what we have. We created a shared definition of well-being as well as guiding principles. So that was what we used then to start making decisions about the work that we were doing, because we all had this shared definition. And then from there, after we looked at our data, we said, okay, here are the areas that we feel are our priority areas, the areas that we really want to concentrate our efforts on, which are below that. So our learning environment. Within our learning environments, what can we do to support well-being? Mental health, right? And so how do we help develop mental health strategies? How do we reduce stigma? How do we help get folks to those mental health supports? Social well-being, providing guidance on social well-being. We've heard that a lot today, that social well-being is really important, connection and connectedness. And then campus infrastructure. So this was looking at our hospital sites as well as our Creighton, our campus, and what do we need to do to develop an infrastructure that supports well-being. So things like, if the printer down the hall always is broken, let's just fix it, because that provides that's a source of frustration. So let's figure out those pieces that we need to do that can just help solve some of those small well-being challenges. And so this is an overview of how this actually got implemented and what we've been working on. This is, in process. This is ongoing. This isn't done. This isn't complete, but this is where we're at, and this is what we've accomplished to this point. So our Wellbeing Executive Committee launched the Wellbeing Index. So we had some more baseline data. We were able to give that individual level feedback to our trainees. We implemented the Listen, Sort, and Power framework, which we learned in the Leading with Kindness trainings. And then we developed a wellbeing website. And that sounds simple, but it was a place where we really curated all of our wellbeing resources and we put them in one place so people don't have to click all over the place. Our learning environment work group developed programmatic wellbeing requirements. So we asked the programs to implement X, Y, and Z. But when we say implement X, Y, and Z, we also had to provide them the tools to do that. And so we curated a list of tools that would help support them to implement those requirements. And then our mental health. So we had some process groups that were in place. However, they were very limited to a couple of programs, and expanding them was not in the capacity that it was being implemented. So we had to figure out a new way to help expand that. And then we looked at social well-being and how do we broaden the scope of well-being in conjunction with burnout mitigation. So how do we help folks understand that idea of social well-being does impact burnout. And the campus infrastructure, we conducted a detailed space audit. So we went and walked both hospitals and we said, okay, these are all the spaces that our residents and fellows have access to. What's going well? What's your wish list? And then we curated a list of the things that we wanted to work on, and we've been ticking those off one at a time, which has gone really, really well. And then as I wrap up, I just want to say that this is what works for us. This is a program or a framework that worked for us. If this does not sound like something that's going to work for you, don't use it. Find something that does. However, for us, it does allow us that idea of data collection, going back, having high-level folks sitting around the table being invested. And so it worked for us because of our organizational structure. But if it doesn't, don't use it. Find something that does. And that's what I have. Thank you.